It's time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up this morning, John has an inside look at the trial and approval process for a new experimental treatment.
Anthony, over the next few months, we'll be following the progress of a novel approach to a disease that affects as many as 350,000 Americans, multiple sclerosis.
11 years ago, Megan Quinn had just gotten married and was the picture of health.
I used to run 5 miles a day. All of a sudden on my 3rd mile, I started dragging my foot. I didn't understand. I thought, okay, I'm just getting old and I'm getting tired. I was 27 years old. But nothing ever clicked to me that something was wrong.
The diagnosis was multiple sclerosis. Multiple sclerosis, or MS, is an autoimmune disease where the body attacks itself and damages myelin, the protective covering surrounding nerve cells. With that insulation compromised, the nerves deteriorate and can cause a wide range of symptoms, including visual problems, fatigue, and weakness.
For the past year, I've had a really bad time with this disease.
In what way?
Just with my hip not working, with one night I woke up and I couldn't feel either of my legs. Right now, my biggest problem is my hamstring. I cannot get my hamstring to cooperate when I have to walk. Now it shakes. See how tense my muscle is?
Right, no, I see that.
Current treatments only try to stop progression of the disease. Megan is about to test a new approach, using stem cells designed to actually make MS patients better.
I'm going to put this on your chest.
Stem cells can be morphed into any cell in the body. Patients like Megan have bone marrow removed, and the stem cells inside are then changed into the kind of stem cells found in the brain and spinal cord. Those cells will then be injected directly into the spinal cord. The hope is they will repair the insulation and perhaps even the wires underneath. Dr. Saoud Sadiq of Tisch MS Research Center of New York is leading the research.
This is the very first time in history that somebody is doing exactly what you're doing. Does it frighten you at all?
It's something that we have to do. I think we have to take these steps because everything else we have done hasn't worked.
John, this new approach now has to go through several stages before approval, right? So what happens next here?
Well, what happens next is she, next week, is going to get the first injection of stem cells if all things go according to plan. And the reason why she's doing this, even though it's really potentially risky, is she wants her life back. Right. She has young kids. She wants to be able to run after them. She can't really run after them right now. And she also sees the silhouette of the future. We know this is an unpredictable disease. She could have further deterioration. She just wants to have a normal life.
It would seem to me that injecting anything into your spinal cord is really risky. I mean, did she talk about that, saying she had fears that other things could go wrong? You
know, she pretty much put it in the back of her head. She knows what the risks are. They were very perfectly and clearly explained to her, and also the fact that we don't even know potentially some of the risks that could happen. But she's willing to risk it because she just wants to be able to run after those kids.
And of course, we'll be continuing to follow her prognosis as it gets further along. Much of the country was in the grip of record-breaking cold this week, and when temperatures drop, the risk of carbon monoxide poisoning goes up. Holly, I don't think a lot of people think of this type of poisoning.
No, Vanita, and we should. You know, every year there are 400 people who die from unintentional carbon monoxide poisoning, and about 20,000 end up in the hospital. So it's something we should really pay attention to much more.
How does carbon monoxide poisoning actually happen in the home, Holly? How do we know if we're at risk for it?
Sure. Well, usually home heating systems are to blame, and that's whether they burn coal or oil or gas. Anything that creates combustion can release carbon monoxide fumes, which are hard to detect because they're odorless and colorless. You don't know that it's happening. So you really need to pay attention to symptoms. Now, symptoms of carbon monoxide poisoning include nausea, vomiting, headache. You might feel flushing and weak and tired. Any of those things, you need to get out of the house right away.
John, when Holly says odorless and colorless, my first thought is, okay, then how do we prevent this?
You prevent it. The number one thing is this, a very simple device, carbon monoxide monitor. You cannot rely, as Holly says, on your senses. And these are inexpensive, they're battery operated, they're very easy to install. I'm going to just hit the button here as a demo. And when it goes off, you hear this very loud beep.
Yeah.
And it can be really kind of irritating.
You kind of have to get up when that goes off.
But that's the most important thing. And believe it or not, Less than, there's no carbon monoxide on this set, don't worry. It's going to go off in a second. Less than 1 in 3 American homes actually have one of these. So if there's one takeaway lesson from today, get the carbon monoxide monitors. Then some other common sense things. Once a year, you should make sure that your heating system is inspected. If you're heating inside, especially on cold days like this, don't use anything that produces a gas or smoke, like, for example, stove or an oven. And then finally, if you smell gas, you should call an expert. Now, remember that Holly said it's odorless. It's not necessarily that you're smelling the carbon monoxide, which you cannot do, but if your system is malfunctioning, if, for example, a refrigerator, it may also be malfunctioning and putting off carbon monoxide.
Right, so that's a very good investment. All right, John, thanks. In Houston, 2 sisters have shared a medical first. Irma Myers-Santana and Anna Williamson both suffered from a disease that causes life-threatening scarring in the lungs. They needed lung transplants, and 2 weeks ago, they ended up in the same operating room, each getting 1 lung from the same donor. This was the first time 2 lungs from a single donor were transplanted into siblings. The sisters are recovering well.
Well, your great-grandmother might have used a corset to keep her figure under control. Your grandmother probably turned to a girdle, but these days, shapewear like Spanx is worn by millions of women. But all that squeezing and tucking can bring some unintended health consequences. So, Holly, as women, we know all about Spanx. I was surprised to hear how young girls are getting into Spanx and that people are doubling up. I didn't even know you could do that to make them even tighter.
Right. Well, you know, the shapewear is incredibly popular right now. I sort of think of what I could issue a warning about that would make me less popular than talking about shapewear. And I don't know if there is any, but a lot of people wear it, and most people wear it safely. But there have been some reports of nerve compression, that's pain and tingling down the legs, frequent urinary tract infections, and other issues with digestion. It can worsen acid reflux.
So what do you do to minimize risks if you want to wear this stuff?
Right. Well, it's really about, these are not 24-hour-a-day, 7-day-a-week garments, right? They should be used infrequently and at most 3 or 4 hours a day. And the packaging itself on a lot of the shapewear warns not to buy a size that's too small. They usually have a diagram of how to know exactly what size you should have, and not to layer it. That can really increase your risk of having some problems.
Okay. Finally this week, it might not come as a surprise that being healthy can make you happy, but it turns out the reverse may also be true. Happiness itself may lead to better health. Canadian researchers have found that people who say they enjoy life tend to maintain better physical function in daily activities as they age. This makes total sense when you think about it, doesn't it?
I love this study. What they did was they studied more than 3,000 people 60 and over. This was in England. And they followed them for 8 years. And those people who started out happier ended up 8 years later having better function. Their gait was faster. They had fewer problems in terms of activities of daily living. And it wasn't just that if you're happier at the beginning, you're probably healthier at the beginning. If you're healthier at the beginning, you're probably healthier at the end. It was independent. There seems to be, and there's a lot of literature about this now, some sort of mind-body connection. I think it's kind of irrefutable. There is certainly a connection.
It's tremendous. And I also like to think about, you know, as we age, one of the things that makes us happiest is just personal, interhuman connection. Right. So whether it's friends, whether it's family, even whether it's a pet, having those connections is likely to keep you happier and hence, as John just pointed out, healthier.
Someone could just come up with a happy pill, you know?
Too. Well, now we'll be watching the spring in both of your steps as you walk.
Happy pill is watching CBS Morning.
Oh, there you go. Smart man.
Dr. John LaPook, Dr. Holly Phillips, thank you for being here.